Despite the comparative success of New Zealand's elimination strategy, there continue to be calls for changes to our approach. A group of academics behind Plan B, as they call it, still think it's unlikely we can keep the virus out. They argue the economic damage from more lockdowns will cause long-term harm to public health, education and the economy, and they say there needs to be a continuing public conversation about our options, because a vaccine may be years away if we get one at all. I'm joined now by epidemiologist Dr. Simon Thornley. Kia ora, welcome to Q&A.
Thanks, Jack. Thanks for having me. I've enjoyed following the coverage of COVID. I think it's been great.
Oh, thank you. And I'm glad we can speak with you this morning. We have a lot more data now than we did in the early stages of the response to COVID-19. Of course, New Zealand clocked more than 100 days without community transmission. Do you still think we need to learn to live with COVID-19?
I want to take a moment to clarify the position of the Plan B group, because it underpins everything I'm going to say. COVID-19 is a nasty flu-like virus. It's new, but it's not unique. The Ioannidis study shows the death rate is only very marginally worse than the standard flu viruses that kill hundreds of sick and elderly New Zealanders every year. The response should be a measured one, like we've planned for lower mortality pandemics, not lockdowns. We've sacrificed our humanity, our society, and our economy for the wrong virus. The fear and panic that has driven the response of many scientists, politicians, policymakers, and the media, we believe, is unwarranted, and it's even irrational.
Okay, I didn't know you were going to read that, but perhaps you can unpack some of those ideas a little more for us. What, in your eyes, would a more measured response look like?
Well, when the government first came out and said the priority should be to protect the hospitals and the intensive care units, I was all behind that, and I think that's where the priority should be. We've seen overseas that that's where the problems have occurred with COVID-19. So we believe now that our current policy is many, many more times more problematic than the actual virus itself. We believe that early on the virus looked very deadly. The infection fatality rates, the case fatality rates were very high, about 3%, much greater than seasonal influenza. Now with serology data coming from many countries in the world, we're seeing those infection fatality rates dialed way back.
So what would it look like? What would an alternative response look like?
Well, we need to do good infection control in hospitals and protect the elderly, rest homes. And we need to do good social distancing in terms of and following the capacity in our hospitals and intensive care units.
We know that our capacity, compared to other countries though, is very poor in those intensive care units, and that we would be overwhelmed very quickly if there were to be a larger scale outbreak.
We know now that New Zealand has a very good ability to modify the capacity in its hospitals and intensive care units.
But how much would we have to scale up?
Well, even at the height of this epidemic, the ICUs were comparatively empty. Our hospitals
but that's because the lockdown
50%.
worked. That's because the lockdown worked though, isn't it?
Well, the science now shows, if you compare countries that did lock down with those that didn't, the countries that did lock down didn't do especially better in terms of overall COVID cases and deaths.
New Zealand's led the world. We had perhaps the toughest lockdown restrictions of any country, and New Zealand has led the world.
That's certainly what it looks like, but if you look at the scientific studies that have been done, there's one in the Lancet, there's been the Meunier study, which has looked at the within-country time trends. We've seen that the data, the science, simply doesn't support ongoing lockdowns to control the virus.
But back to our success early on in this response. I mean, clearly New Zealand had much tougher restrictions than many other countries, We've had lower rates of COVID-19 as a per capita measure. We've had relatively low death rates compared to most countries on earth. Indeed, I mean, Forbes magazine, I think yesterday, called us the second safest place to be in the world. We've seen economists such as Joseph Stiglitz saying New Zealand has been world class in its response.
Well, New Zealand's response was appropriate for a more severe virus, one that we thought that we had when we had the early data, but we haven't adjusted for the science, which clearly now shows that this virus is not as serious as we first thought. You said that yourself, Jack, back in March. You said we need to be fearful of the virus, but not too fearful, because it's not that much worse than the flu.
I didn't say that. I would certainly not have made any sort of comment like that comparing it with the flu, because I don't personally know. I'm not an epidemiologist. I do appreciate the need for balance in a response, though, and I accept that there is a school of thought, there is an argument that by locking down we cause a degree of economic damage that in the long run will prove to be more damaging than short-term lockdowns. I accept that that is the position of your group, for example. What about our more vulnerable populations? You look at the report in the Medical Journal on Friday that indicates Māori are significantly more at risk of COVID-19 complications and death than non-Māori in New Zealand. As treaty partners, how should we handle that information?
We obviously need to do the best we can do as a society to protect our vulnerable, and that includes Māori and Pacific New Zealanders. But we know overall that this virus is not the deadly virus that we feared now. We've seen the updated data. The Ioannidis paper clearly shows that the infection fatality from this virus is about 2 in 1,000.
We've had 2 people die in the last 48 hours in New Zealand. Deaths in the United States are fast approaching 200,000. So clearly, in particular for people with pre-existing conditions or who are particularly vulnerable, this is a deadly virus. What would you do to protect the quarter of our population who are particularly at risk?
Well, we need to use the principles of infection control and what we've used to control the infection of other viruses with a similar mortality rate. And that doesn't involve locking down the country, locking down vast swathes of our population who are at very low risk from the virus.
I know a lot of comparisons have been drawn with Sweden, but knowing what we now know about this virus, is there a country or a place you think New Zealand should be emulating at this point in the response?
Well, I think the long-term response is important here, a sustainable response that our country can continue with over a long period of time. And with this virus, elimination is just simply not warranted, given what we now understand from the science and the infection fatality.
So is there a country you can use as an example for New Zealand?
Well, I think Iceland is a particularly good example. So they've done widespread testing, but they've readjusted the risk of the virus. They're starting to open up their borders. They're allowing tourism. They're not locking down. So I think if you look to Europe now, you see that many countries are adjusting their risk to the virus.
Spain had 50,000 cases last week.
Well, you look at the epidemic curves and you'll see that the death rates have come right down now. And if you look at the deaths overall, you'll see that the deaths in each country are in age groups that are about the same as what we expect for natural mortality.
Let me ask this. Observing this debate from the outside, it's looked nasty. A lot of this debate has verged on being quite a personal debate, at least from the outside. Do you personally, you are an epidemiologist, have you personally published work on communicable diseases?
Yes, I certainly have.
I've considered your published works, and a large proportion of those, at least, focus on things such as tobacco use and alcohol use and that sort of thing, as opposed to something that might be more directly relevant to a pandemic?
I've been working in public health on the measles outbreak. I've been doing models of infectious diseases. So if I can't speak out on this issue, I'm not sure who can, Jack.
Yeah. Do you feel like it's been personal?
I think one thing that has shocked me about the debate is the lack of debate. That science, we know, is about diversity of opinion, and I believe that the government has been captured by scientists who have extreme views. If you look around the world, there are very few countries that are chasing an elimination strategy for this virus.
But there are very few countries where that might be a possibility. Thank you very much for your time, Dr. Simon Thornley. It is an important conversation.